So this is the semitendinosus graft, which is about 27 millimeters in length, and the diameter which I was getting was about 8 millimeter. So I had to add gracilis as well. Again, this is 27 millimeters in length. Okay. So combinedly, what we will do is we are going to quadruple it to get a graft like this. Okay. So this which I measured now, it comes to about 10.5. So let me see after preparing with the tight ropes and internal brace. So this is the tibial side of the graft. I've got 10.5 here, and for the femoral side, I think I'm going to get 10. Yes, 10. It will be tough here. This one we are going to get 10.5. And for the femoral side we are going to get 10. 10. Yeah. ಕೆಲವು ಎರಡು ಕೈ ಇದೆಲ್ಲ ಬಿದ್ದೋಗುತ್ತಲ್ಲ, ಎರಡು ಕೈ ಉಪಯೋಗಿಸೋದು ಬೆಳೆ ಯಾಕೆ ರಿಟರ್ನ್ ಮಾಡ್ತೀನಿ. ಇಲ್ಲ 10.5 11 ತಗೋತೀನಿ. 11 is comfortable. Yes. Tough. I'll go 11 on the tibia and 10 on the femur. 10 femur. 10 ala? 10 is fine. 10 femur and 11 tibia. And the graft diameter, that's a graft diameter. The graft length what I have achieved is about 65 millimeter. Excellent. So I am now washing the graft. It's saline, and this is a saline soaked gauze. I'll be wrapping the graft and impregnate. This is a vancomycin antibiotic. This is basically to prevent infections. Thank you. So this is the ACL graft which is finished with the internal bracing with anthrax tight ropes on both the sides. This is the internal bracing. This is the fiber tape. This prevents stress to fall directly on the ACL in cases of an impact. Okay, thank you.